been streaming in, which is okay. We'll just begin so that we can be on time for our schedule. So my name is Jean. I'm Jean Fu. I represent FinTech Academy, as well as being part of the Healthcare FinTech Alliance. So thank you all very much for coming today to listen to what we have for you today. So basically, we are going to start off just by introducing a little bit about Healthcare FinTech Alliance. And as you probably know by now, for those of you who have signed up, knowing through our posters and our publicity materials, that Healthcare FinTech Alliance is actually co-organized by Pfizer, as well as Alibaba Cloud and FinTech Academy. And for today's webinar in particular, we are supported by a number of supporting partners, as you can see on our screen. That includes IQVIA, Med247, EY, as well as ICAEW. And among that, we also have other kinds of participating sponsors, as well as universities who have actually helped us to get this message out across Vietnam. And we are very happy to say that we have over 50 people who have signed up. So today, I'm just going to walk through the flow of the webinar and introduce a little bit about the innovation challenge that is actually tied into this process, okay? And after that, we will have a very good lineup of speakers that would speak. So I would like to just briefly introduce, for those of you who are coming in, especially from Vietnam, Vietnam is one of the countries that will participate in the regional challenge of Healthcare FinTech Alliance Innovation Challenge. The purpose of HFA Innovation Challenge is to really to get startups and innovators who are very passionate about healthcare entrepreneurship to be able to pitch their ideas to be supported by Pfizer, Alibaba, and FinTech Academy. So this across the board, we have a official submission deadline of August 30th. Now we are working with over 40 universities to have teams submit their interesting ideas to us. And the deadline is in about 2.5 weeks, and we have been getting pretty good signups. So for those of you who are actually keen to join, this webinar will actually help you a lot, because you're going to hear about success stories of successful startups and how they've gotten to where they are. You would also be able to hear about healthcare trends within Vietnam and the ASEAN region, and to see where your idea can actually fit in when it comes to the theme of affordability and accessibility. So I just wanted to let you know that with the cutoff date, the submission deadline of August 30th, there will actually be a qualifying round for Vietnam, which takes place on September 5th. Now that's for the university teams. And with the university teams, we have a very special program for you where there will be design thinking workshops throughout the month of September, so that we can prepare you to participate in the finals towards October and in November. The finals will be in November, but there will be some other kinds of preparation activities that happens in October as well. So for all those Vietnamese university teams that are here today, please take a great note of the deadline, which is August 30th, to submit your pitches. I'm sure you're working very much with your professors who will be helping you with that. Now, for all of you, the rest of you who are actually not from the universities, but from the professional sector, whether you are already an entrepreneur or you are launching a brand new company, you are also welcome to submit it. The deadline is also the same, which is August 30th. And from there on, we would be able to have our judges pick out the qualifying teams to move towards the competition rounds, competing with other regional teams. Okay, so let's move on to talk a little bit about the webinar that is part of the Innovation Challenge. So today's webinar, we will actually be focusing on entrepreneurship and investing in ASEAN healthcare. We had a very successful webinar for the Indonesian community, and this is for our Vietnamese community. So our speakers today are also focusing on the Vietnamese sector, and they will be able to share a lot more with everybody about what we're going to learn. So for those of you who have just joined in, before we actually step into the speaking part of it, I would actually like to invite Dr. Lillian Cole, co-founder of the Healthcare FinTech Alliance, to represent Healthcare FinTech Alliance, to actually just say a few welcoming words and inspire all of us to really have a great takeaway from today's session. So I would like to find Dr. Cole, please. 1 second. Okay, Dr. Cole, just 1 second. I am going to, yep. So you are unmuted. Please go ahead and make your welcoming speech.
Thank you, Jean. Good morning, everyone. And it's lovely to see you on a Saturday morning for the Entrepreneurship and Investing in ASEAN Healthcare webinar. We are very proud to have this wonderful partnerships with all the logos you see behind Jean, right? And this is so nice that we are all gathered here for a very, very common shared mission. And that is, we want to know that how can we get our youth and the startups wannabes to think about how we can make healthcare better, cheaper, faster, and maybe great innovations that's going to have social impact. Today, we're going to have wonderful speakers who are going to tell us how this has been happening and how there are more opportunities for any one of us who dream to solve this social impact. And there will be a lot of mentoring, either by Alibaba Cloud, by Pfizer, by HCA, by ICAW, EY, or any one of us who are willing to come together, especially in times of this COVID-19 epidemic. It is wonderful and heartening to see people gathering to do our best for making the world a better place. So thank you for being with us. And without further ado, I'll hand back to our wonderful Jean to host this session today. Have a good session. Thank you.
All right. Thank you so much, Dr. Cole, for that very inspiring welcoming. Now, before we actually go into the speakers proper, I would just also like to introduce briefly our 3 speakers for today who will talk on different topics. All right. We will first have Sri Harsha Sarkar, who will actually talk about FinTech and healthcare trends across ASEAN. And he's representing IQVIA to share his insights on that. Our second speaker for today is going to be Tuan Chuang, who is a co-founder and CEO of Net247, which actually represents very successful clinics as well as an online version of what they do to improve affordability and accessibility of healthcare in Vietnam. And finally, we have Sol Magas representing Ernst & Young to be able to talk about healthcare trends across ASEAN. So maybe we have the slide for our first speaker, please. Okay, so without further ado, we're actually going to invite our first speaker, Harsha Sarkar, to introduce his company as well as the topics that he'll be talking about today. So Harsha, please, you can share your screen.
Thanks, Jean. Hi, everyone. Good morning. Very happy to be on this webinar and to be speaking with all of you. My name is Sri Sarkar. I'm a senior principal with the consulting practice of IQVIA. IQVIA, as you might know, is one of the largest service providers to the pharma and healthcare industry globally. Our services include data, information, consulting, analytics, technology, as well as clinical trials and R&D. So we have service offerings for the pharma industry across the value chain, from molecule to market. I'm part of the consulting team of IQVIA, based in Singapore, covering Southeast Asia as well as broader APAC. As part of the consulting team, we offer commercial strategy consulting services to our clients in the pharma and healthcare sector. For today's discussion, the topic that I wanted to cover was healthcare trends in Southeast Asia, specifically focusing on the pharma industry. And given that COVID-19 is such a big market event at this point in time, we thought we would focus our presentation today on the impact that COVID-19 is having, and the key shifts that we see on account of COVID-19 in the pharma market in Southeast Asia. In terms of the key topics, we'll start with the pharma trends in Southeast Asia and the extent of the impact that the pandemic is having. And then we look at a few key trends on how the pandemic is fundamentally changing patient behavior, HCP behavior, and how that is necessitating a change in the way the industry approaches healthcare provision, as well as engaging with key stakeholders and customers in the sector. To begin with, we thought it will be good to take a quick look at the trends in terms of the numbers of the infected during the pandemic. What we have here is the cases per million across Southeast Asia or ASEAN, as well as the daily new cases that are being seen in the ASEAN countries. Vietnam has fared much better compared to most other ASEAN countries during the COVID-19 pandemic. As you can see, in terms of cases per million, it has the lowest, which is great. Some of the other ASEAN countries, like Indonesia, Philippines, and Singapore, have been much worse hit by the pandemic. If you see the chart on the left, which shows the daily new cases, you can clearly see that that there is there are two clusters emerging: Philippines, Singapore, and Indonesia are the more affected countries, whereas Thailand, Vietnam, as well as Malaysia have managed to keep the pandemic in control to a large extent, and the charts are clustered much lower here. What impact has this had on the pharma market? So this is IQVIA data. We track pharma market data at an SKU level across 90 countries globally. This is from our national sales audit for the 6 Southeast Asian countries. What we see here is the 2019 and 2020 pharma market sales trends. The light blue line is the 2020 sales from Jan to May. And the dark blue line is the 2019 pharma market sales in the same period. As you can see, until March 2020, the sales in 2020 were tracking in a similar trajectory to the 19 sales, which suggests that Q1 this year in the pharma market in Southeast Asia wasn't particularly impacted. This is of course different for some of the more mature markets which faced the pandemic earlier this year. But the numbers in Southeast Asia in terms of new cases or new infections didn't really peak or rise until Q2 this year. April is when the market in the region started feeling the impact. You can see that there was a dip, and in May the sales really went down. So what you see here is a 20% year-on-year decline from May 19 to May 20, month on month. But if you actually look at the way 2020 sales were trending, May 2020 should have been closer to 1.2 billion or slightly higher, but it's actually closer to 800 million, which indicates an impact of about 30 to 35% decline over baseline forecasts for May 20. That's the extent of the impact that the pandemic has had on the ASEAN pharma market, and we expect this kind of an impact of 30-35% to continue over Q2 at least, over Q3 at least, and maybe into Q4 as well. Of course, the impact on the pharma industry will be much longer term. And we have a slide ahead which talks a little bit about the forecasts. What we have on this slide is we've also then broken down the impact by therapy area, because we have the data, and it's important to look at how the pandemic is impacting different therapy areas within the industry. This slide shows the May 2019 versus May 2020 sales across the key therapy areas in the pharma market. Again, this is for ASEAN. What we see is that the hospital-driven therapy areas, so the indications that are treated in a hospital, like anti-infectives, like oncology. So this is oncology. You see that musculoskeletal, respiratory have also seen a major decline. But these are the therapy areas that are more impacted and have seen a 30 to 40% decline over May 19. Whereas some of the therapy areas that are more retail driven, chronic care areas such as metabolism, which is diabetes, as well as chronic care, but retail driven therapy areas such as cardiovascular, have had a lesser impact than the hospital driven therapy areas. And this is predominantly because the pandemic has impacted mobility, with mobility restrictions being put in place in the months of May and June in quite a few of the Southeast Asian countries. Patients have found it difficult to come into hospitals, and patient volumes have been declining significantly in a hospital setting. It's not just the mobility restrictions. Even when the mobility restrictions have been eased or partially lifted, even then the patient volumes in hospitals have remained low, which indicates that there is a behavior on part of patients to avoid visiting hospitals unless absolutely necessary. And that's what has impacted the sales in the pharma industry in the hospital sector. We've gone one level granular and looked at specific sub-therapy areas, and we actually found that some sub-therapy areas have actually grown even in the pandemic, and these are largely the for example, vitamins and minerals. So supplements, which are largely sold through retail and more over the counter, or driven by self-medication, have actually grown significantly. In fact, up to 60% growth over May last year. We've also seen growth, like I said, in a few diabetes driven segments, and viral vaccines, which is also expected in the COVID period. Whereas hospital-driven anti-infectives like broad-spectrum penicillins, cephalosporins, as well as oncology. This protein kinase inhibitors is, is a class of drugs used for oncology. These have been the segments that have seen the highest decline in ASEAN. When we look specifically at Vietnam, the decline in Vietnam has been lesser than the rest of the ASEAN markets. For example, for overall ASEAN, we have seen a 20% decline over May last year. For Vietnam, that decline has been slightly lesser, around 15%. But in terms of the therapy area trends, the same trends would apply to Vietnam as well. The same as what we see for overall ASEAN markets. In terms of the the forecasts and how things are expected to evolve, it's difficult to, of course, kind of predict how the pandemic will evolve. But what we've done is we've looked at the current scenario, and if we kind of assume that in a best case the cases will come down and there wouldn't be a second wave, we expect, even then we expect recovery to not happen until Q1 or Q2 next year. So the dark blue line that you see in this chart is the forecast or our interim forecast for the pharma market in Southeast Asia. And the numbers that you see are the difference versus baseline forecast for those months, right? So if we look at historically what happened this year, earlier this year, actually the pharma market grew a little more than what the baseline forecast was. And this was because of a stockpiling effect that we saw in many of the markets in ASEAN, where in anticipation of the pandemic, there was some stockpiling that happened in supply chains in the pharma industry and the pharma market. But in Q2, particularly in the months of April, May, and June, we saw a decline, like I said, 30 to 35% decline from baseline forecasts. We expect this decline to continue into Q3 and Q4 this year. And in a best case situation, even into Q1 this year. However, if there are further waves of the pandemic, we'll of course kind of keep looking at these forecasts and revising. To be honest, we do anticipate the situation to be worse than this. And given the way we are seeing numbers in markets like Philippines and Indonesia escalate, we fear that things may not be back to normal even a year from now or maybe longer. Right. That was a quick overview of the trends in the pharma industry and the extent of the impact that the pandemic has had. Now looking at some of the key trends that we see and the key shifts happening in fundamental behavior, whether it's patients or healthcare providers or healthcare players and the pharma industry. So we've categorized these shifts or trends into three major buckets. The first is the disruption in the patient journey that we see happening. Like we discussed previously, there has been a decline in patient volumes across hospitals. Patients, and it's not just on account of mobility restrictions. There is an amount of fear in the minds of patients across ASEAN to go and seek care in a hospital setting or in a clinic setting. At the same time, there is an increasing trend towards self-medication, and particularly which is manifesting in growth in the OTC, over-the-counter sales of drugs. With these changes in the patient journey, healthcare provision is having to adapt. We are seeing, healthcare providers, whether it's physicians or hospitals, adapting. They understand that patients are unwilling to come to and seek care in hospitals. So we are seeing postponements of surgeries. Elective surgeries, for example, are getting postponed, and this is of course impacting the medtech segment or market as well. There is an increasing adoption of telemedicine, and technology. Everyone is acknowledging the role that technology can play. Um, we have some numbers which, in upcoming slides, which suggest that physicians are a lot more willing to consider telemedicine as an option to see and treat patients. Um, and at the same time, the infrastructure for home delivery of drugs is evolving. So what's essentially happening is healthcare provision is having to adapt, putting patients at the center, and bringing the care to the patients. Given that patients are now averse to the traditional healthcare journey of going or presenting themselves to a clinic or a hospital to seek diagnosis or care. With these changes happening in the healthcare ecosystem, the pharma industry is having to evolve. There is a clear shift towards leveraging digital and virtual engagement with their customers. So the pharma industry is shifting from the traditional face-to-face model of engaging with their customers, which is healthcare providers, or even with their patients, towards a more digital and virtual engagement model. With that, they are having to rethink their sales and marketing models, reskill their employees, and redeploy their teams and investments, and look at a more multi-channel or omni-channel approach to sales and marketing. At the same time, they are also having to reconsider their launch strategy for new drugs. I have a few slides which capture some of these trends, and I'll go through them over the next 5 or 10 minutes. And I think before I kind of close out my presentation for the day. So when we talk about disruption of the patient journey, these are outputs from a survey that we recently did across Southeast Asia with about 250 healthcare practitioners. We spoke to doctors and we asked them about patient volumes in their hospitals. And what we heard back validated our hypotheses that patient volumes indeed have gone down significantly in Southeast Asia markets. Again, there were two clusters in terms of countries that emerged. The ones that are where the outbreak is more severe and continues to escalate, countries like Philippines, like Indonesia, and even to an extent Singapore. The patient volumes in hospitals have seen a much steeper drop, have declined from anywhere between 50 to 70% from normal levels. Whereas even in other countries in ASEAN, like Malaysia, Thailand, and Vietnam, patient volumes have gone down a fair bit. So we did this survey in July, and Vietnam appeared to be the least impacted in terms of patient volumes, and the extent of the impact is much more severe in countries like Philippines, Indonesia. At the same time, we asked the physicians when they expect patient loads to come closer to normal. And again, there were two clusters of responses. The lesser impacted market said about 5 to 6 months, whereas the more impacted markets felt that the impact was likely to be 3 quarters or even a year before patient volumes become closer to normal. So clear evidence that hospital patient volumes have indeed declined. At the same time, like I said, there is a trend towards increasing self-medication. So this is a survey that we conducted of about 240 pharmacists across the ASEAN countries. And across clinics or hospital pharmacies and retail pharmacies. We asked them about patient loads in pharmacies, and their responses seem to suggest that self-medicating patients has a as a percentage of the total patients that come to pharmacies have gone up. um, and newly diagnosed patients as a percentage of patients that come to pharmacies have gone down. So what this indicates is patients that were already being treated or already on drugs, their percentage has not changed. The percentage of patients that are self-medicating or buying over-the-counter drugs has gone up, and newly diagnosed patients has gone down. So there again evidence of the fact that the patient journey has been impacted, and newly diagnosed patients are coming down. In terms of how healthcare provision is adapting to these trends, we have some data again from our survey of healthcare practitioners on how surgeries have decreased in the period. So again, in the month of July, when we spoke to these physicians or surgeons across ASEAN markets, most of them, about 50 to 60% of them, said that the number of surgeries had gone down by more than 60% over the normal volumes. So a substantial decline in surgeries. Of course, they do expect things to get normal over a 6 to 10 month period, but clear evidence that the volumes are declining. And they also said that the prescription duration, so the prescribing behavior of physicians has also changed. They are now prescribing, for a longer duration. And across ASEAN countries, the percentage increase is different, but on an average, about 30 to 50% longer duration for prescriptions. Which is we thought another interesting insight in how healthcare provision behavior is changing. And finally, moving into the key piece that we feel will evolve is the adoption of digital for both healthcare provision. And we'll come to the next slide, which talks about the importance of digital for the industry to engage with key stakeholders. So starting with telemedicine, we, in the same survey that we did of healthcare practitioners, we asked them about their adoption of telemedicine. And there were about 38% of the respondents who, before the pandemic, did not use telemedicine at all, but had started using telemedicine since the pandemic. And a 40% number is a pretty significant number in terms of indicative of how the pandemic has accelerated the use of telemedicine. We also asked the prescribers, what percentage of their patients are they seeing via telemedicine, and there was a definite increase in their view in the number of patients. Though still, the percentage of patients that they were seeing via telemedicine was in single digits in most countries. But we feel that this trend will continue to grow. And we are seeing that governments in ASEAN are actually looking closely at the adoption of telemedicine as a way to deal with the disruption that the pandemic is causing. So, for example, in the Philippines, the Department of Health has partnered with private providers of telemedicine and is also kind of building a regulatory framework to enable telemedicine to function, and you can see that that's led to a much quicker adoption of telemedicine. In Vietnam as well, the Ministry of Health has recently approved a project which is looking at remote medical examination and treatment. They are working to build a telemedicine platform which can enable remote diagnosis, remote consultation, as well as remote treatment. So clear indications that the pandemic is leading to more opportunities in this space. And clearly this is a trend that is here to stay. We did ask the prescribers whether they are willing to continue using telemedicine even after the pandemic, and there was the response was overwhelmingly positive. Along with telemedicine, the other enabling infrastructure also kind of needs to get developed, and we are seeing trends across ASEAN, including Vietnam, on this happening. Multiple pharmacy chains, whether it's Pharma City or others in Vietnam, are launching home delivery services. Some of them nationwide, some of them within a certain radius of their stores. But this is a trend that's increasing. There are other platforms in Vietnam that are coming up for providing teleconsultation as well as delivery of medications. Finally, with these changes, what do we see as key implications for the pharma industry? I think to begin with, of course, the pharma industry has to look at their new launches. We are seeing prioritization of new launches or new drug launches or new product launches in the industry. Of course, drugs or vaccines that are related to the pandemic, to COVID-19, and for direct use during the pandemic are being accelerated. But out of product launches in other therapy areas, what we are seeing is a prioritization of launches. There are some launches that are getting delayed and affected by the pandemic. However, products that are addressing high unmet need in specific therapy areas are still going ahead. And we've seen 15 to 20% of the launches that were planned for this period, for early 2020, still go ahead. So pharma companies are not really halting and pausing everything, but they are prioritizing, and we feel that that's the way to go forward, given the challenges in launching a new drug at this time. The other key imperative is on how to engage with key stakeholders in the industry, right? Given that in the last couple of months, the traditional engagement model that the pharma industry has with their customers or with HCPs has been disrupted. In quite a few countries, like in the Philippines, sales reps are just not able to see physicians because physicians don't want to see them. It increases the chance of exposure, and even pharma companies prefer not to expose their employees or increase the risk of exposure for their employees. So in this kind of a situation, what is happening is virtual engagement is being accelerated. This was always a trend that was coming in the pharma industry, but what the pandemic has done is force the industry's hand. The pharma industry has been dabbling with digital, but to be honest, it has been a bit behind some of the other sectors in truly adopting digital engagement. But now with the pandemic, there is no choice. And we are seeing physicians as well becoming a lot more receptive to digital engagement. In fact, we have, in the months of the pandemic, we have seen a many-fold increase in virtual engagement, whether it is through online platforms or webinars with, with HCPs and KOLs. Even sales reps are using, tele-detailing or e-detailing or emails, instant messaging apps, and video calls, given that face to face is a challenge. So this is again information or data from our survey where we asked HCPs, how much time are they spending on F2F versus other modes of engagement pre-COVID and during the pandemic, and the trend that emerged again was that there is an increase in the use of virtual or remote engagement tools in during the pandemic. So what is happening is the pharma industry is now having to rethink their sales and marketing models, right? So they are having to look at a more hybrid kind of a model, which brings in face to face as well as non face to face or virtual modes of engagement. But the challenge with this is how effective really is digital and virtual engagement, and that's the question that the pharma industry needs to address. Uh, Going forward, as all companies or all pharma companies, increase their intensity of digital or remote engagement with physicians and patients, what is happening is there is a kind of virtual fatigue that is setting in with healthcare professionals and doctors, and it's becoming increasingly difficult to differentiate in a marketplace like this, where everyone is using digital engagement. So this, for example, shows that during the lockdown, there was a 3 to 6 times increase in non-F2F engagement, non-face-to-face engagement across ASEAN markets. With such a large volume of digital engagement, how do you differentiate your product or your brand in the eyes of the physician? And the answer to that is, of course, knowing customers better, understanding different personas and profiles of HCPs, and customizing engagement modes as well as the content to the right personas. So that kind of orchestration of omni-channel engagement, customized to different healthcare providers and to their preferences, is something that the pharma industry now needs to build as a core capability as part of their customer relationship management and their sales and marketing efforts. And there is a need to, of course, reskill and retrain their teams to be able to navigate this transformation, along with investing in the appropriate technology and analytics infrastructure to enable this change. So I think this is my last slide before I conclude for the day. But essentially, we feel that in this kind of a marketplace, the new normal will require a better customer relationship management through evidence-based, personalized multi-channel engagement, and that begins with a better, deeper understanding of the pharma industry's customers, and the core of which is having data and insights on their customers, having the right algorithms to be able to tag that data and categorize their customers into personas or profiles, and then developing the right marketing content and marketing programs which can address in a more personalized or customized way the journey that the customers are going through, while giving a consistent seamless experience of the company's engagement with the physician. So there is a digital transformation coming, and the pharma industry needs to be prepared to and invest in capabilities for that transformation. That's what we had today from IQVIA's perspective. Thank you very much for your time and for your patient listening in.
Thank you so much, Sri. That was really an in-depth, quantified presentation of healthcare trends, especially across the ecosystems where stakeholders need to kind of pay attention to. So thank you so much for sharing that very insightful presentation. So now that Sri has actually shared that with us, let us introduce our next speaker. He will actually be a real case study for all of us. And the next speaker that we have is Tuan Truong, and he is the co-founder and CEO of Med 24/7. And I will let him share with us his journey in building this very successful startup, which is a blend of physical clinics as well as digital solutions. So let's hear from Tuan and see how his case study fits into what Sri talks about when it comes to solutions for the healthcare ecosystem. So Tuan, please.
Hi, thanks June, thanks everyone for listening in, and thanks Healthcare FinTech Alliance to organize this webinar. I think it's really helpful for us as a startup, and also for others who want to who work in the healthcare industry. And thank Sri for the great presentation. There's a lot of numbers and a lot of good information that I got from the presentation as well. So can you guys see my screen? Yeah.
We can see you. Yeah.
Yes. Okay. Let's start. So my name is Tuan Truong, and I'm the co-founder and CEO of Med 24/7. We our aim is to empowering our patients through technologies and innovative design of healthcare. Our vision is that we want to be the 24/7 ecosystem of high quality health tech in Vietnam in the region, offering both online and offline family care. Vietnam healthcare market is growing, and the spending estimate for pharmaceutical spending is around 6.6 billion by 2020, and for the healthcare spending is around 10 to 2 billion by this year. And even though Vietnam has been recognized as one of the countries who been handling the pandemic well, we still have a lot of the problems in the market. Right now, the average waiting time is still around 42 minutes for each of the patient when they go to the hospital. 73.3% of them actually go direct to the national or one of the specialties hospital instead of going to one of the family clinic or one of the lower level hospitals. Actually, Vietnamese spend around 3 billion per year going to Singapore, Korea, or other countries for healthcare. And with the COVID, this is actually preventing people from doing that now. So those revenue actually go back into the country now. The occupancy rate of Vietnam public hospital is still 120%, so it's always overcrowded. For the market shares, as you can see, there's a large number of district level and other public types of healthcare service. But the problem is that people are still prefer to go directly to one of the province level or go to the national level, and that's leading to the overcrowded of those hospital and clinics. However, there's a few key drivers of growth healthcare in Vietnam. The middle class wealth is that by 2030, there's an estimate around 95 million of middle class people in Vietnam. And as you see previously, the healthcare spending is gonna increasing every year as well. Vietnam used to be a young population, but now it's getting to the point that 21% of the total population will be 65 or over in 2050. So because of the aging population that's coming up, there's a more requirement for the long-term and age-specific healthcare. And this increasing more pressure and more challenge for the healthcare, and actually gonna promote the digital healthcare as well. In order to the government know about this, so they've been opening up more for the foreign investment law, so that's allowed the foreign investor to look into the market, because the market is potential, and there's a huge requirement for it. Vietnam is also known for really high digital adoption rate. Actually, 95% of the nationwide is covered with 4G or 5G. However, there's a bit of fragmented data and cybersecurity problems. However, the internet penetration is gonna go up 28% per year. So what Med 24/7 offer is that we probably one of the pioneer in merging both the online and offline healthcare. We have a chain of Med 24/7 on offline clinics with top doctors and nurses that carrying the same treatment philosophy. In each of our clinics, we have our own pharmacy as well. So we have the whole ecosystem of people going from booking to getting the medication themselves. The idea is that we're gonna build this chain of Med 24/7 clinics based on the same standard operation procedures that backed by our own clinic management system. This is our tech underlying to make sure that we have the same qualities overall in all our clinics, because to us the quality is what's gonna stay with the brand. And in healthcare, the quality is the most important thing for us. In combination with this offline, we gonna have the telemedicine as well on our Med 24/7 app. On those apps, because we have the offline, so that people are easily convert to online because they have all the medical history onto the app already. So for example, we found that if you go straight to online, with the Asian culture, and especially in Vietnam, it's still a very new thing. Even with the COVID-19, it actually pushed up the telemedicine growing. However, it's still the culture, it's still the barrier that people are still prefer face-to-face instead of the online. However, if they know the doctors, if they already see the doctor, it's very easy for them to convert to online. And that's what we found actually working so far. And with this online telemedicine, we can offer 24/7 service and also shipping the medication to the patient as well. And by using the app, we also actually building the community, so people are not necessarily talking to any of the doctors, but may share the experience, share the information with other patients who may have the same problems. And it's actually been working quite well so far. As I mentioned, we built our own clinic management system. Our system consists from booking through the app to pre-check, to ask for the nurse to handle all the necessary work, and also for the doctor to provide patient with health check, treatment, prescription. We have our own blood test and laboratories test as well. Also, it's gonna include have the pharmacy, so that our pharmacists can provide the patients with the medication afterward. So we actually have the full cycle of customer management to our clinic management system. So what makes us different from others is that we try to provide premium service with affordable using the online, because online actually help us to reduce the pricing and also reduce the fee for the patient as well. We focus on medical excellencies, and we make sure that we are the one-stop shop for the patients. We believe that we're gonna bring out the next family generations for the young people. 65% of our patients actually are pediatric, and in the young, we found that the young parents, the next generation, they're actually more open to healthcare, especially on the digital healthcare as well. So young ambient dynamics, and we want to make sure that we have a standard around all our clinics, both online and offline as well. For each of our clinic, we do have like some kind of like a Bible, a playbook for each clinic, so that we follow the same treatment protocols. This is really important since in Vietnam there's still limited number of doctors. So far, it's only 8 doctors per 10,000 people in Vietnam, comparing to 30 or 33 in developed countries. Therefore, there's still a lack of consistent quality between different doctors, different treatment. So to make sure that we have a standard, we need to define the treatment protocol that followed throughout all our clinics. We do have a good resource pool of doctors and nurses, and all of this backed by our underlying technology platform. The technology here enable the doctor to serve more patients in a time, and also to help them to provide assist them with the knowledge, with the with the standards of practice. And using technology help us to minimize and optimize our costs as well, hence reduce the pricing for healthcare. So our core values is lying at the quality. We really believe that the quality is the top thing that we need to keep in order to grow our brand. We actually have a brand manifesto as well. It's a bit like a poem that empower our patients. What makes us different is that when patients come to us, we want them to have the right to understand their treatment, to understand the root cause of the illness, instead of just giving them the medication. And by our tagline is be empower, meaning that they have the right to knowing about their well-being. They have the right to talk to the doctor anytime, to seek assistance from the doctors at any time. So it is the main thing that inspires us for building up Med 24/7. Our company is actually quite young. We start from March 2019. We got the seed round from KK Fund and a few angels. Even before we actually launched our product. And since then, we've launched our first clinic from July. We got both the GP clinic and the pharmacy license. We have 5 full-time doctors and around another 5 contractors, 10 nurses, and 1 pharmacist. Since we've been testing our system and our procedures, and at one time we were handling 150 patients in 3 hours at the same time. Up until now, we got around 18,000 registered users, with more than 10,000 visits at our offline clinics. Since the COVID, we actually see the 30% month-on-month in our telemedicine as well. The adoption for online consultation, even the patient haven't come to the clinics, have been really well received as well. As what Sri mentioned, we believe that COVID-19 has pushed the telemedicine in Vietnam faster than what we intended. We do see the decreasing number of offline visits as in the previous presentation. However, we've been quickly transform a lot of the activities to online, and we see the increasing number of online as well. Here's a video of our clinic. I'm gonna show you guys a quick video of how our clinic look like. Because we believe that the clinic should be a nice environment where patients feel the comfort, and also to feel like it's not a clinic, but actually a clinic. So how it works is that our philosophy is that we focus on patient centric. We create things our patient as a relative, because I'm understanding from the culture here, people still prefer word of mouth other than on the digital ads, on of the campaigning, or on the advertising. People are still very much word of mouth coming to healthcare. So we will try to understand and respect patient preference. We coordinate and with the integration of care using our technologies. As Sri mentioned before, we believe that the next healthcare generation is a lot about personalization. How you can provide the personalized comfort, how you can understand deeply about the patient before actually provide them with the care. We believe that in healthcare treatment, 50% of them is medical. The other 50% is the non-medical, which is how once the patient feel the comfort, feel the peace of mind when they come to the clinics, they already like 40-50% cover from the illness. The other 50% is actually coming to the treatment. How you gonna the treatment gonna be effective. So we really believe in personalized healthcare support. And for all the patients, been working well so far that it's only start with the pediatric. They bring their children to the clinics, but because they like the environment, they like the understanding, they like the comfort, so they bring the whole family to our clinics. So it's like going from one person to actually the whole family joining our clinic, and that has been inspired so far. So how do we do personalization? Is that we try to bring the awareness to personalized content. Once we target on the content, we understand more about the patient behavior, what they worry about, how they worry about, and then we start building up the profile so that they start, be loyal and they wanted to go to us for the healthcare. So this is how we building from curious to like, dislike, to love, and to loyal, and building our growth from awareness to search and consideration and to trial use. Because healthcare is so much different from e-commerce. E-commerce, you advertise and people buy the product, but in healthcare, you have to start educating, provide them with the content, get them to know about your brand and what you do first, and hopefully someday when they have the problem, they think about us because they've been following us, they've been, understand about our philosophy and how we give care to people. Recently, we've been doing market research on consumer behavior since COVID-19, and actually in Vietnam there's a rising demand for healthcare because people are now worried more about the healthcare, how you can actually more preventions and how you can keep the healthcare, and they right now the behavior is they easier, more flexible to switch the brand before they follow on the brand doctor or on the brand clinic or on the like really old school or long-term hospital. But now they are willing to choose the location that close to home or even the digital healthcare as well, and they're more welcome for digital healthcare. The barrier for digital healthcare has been less now, and they are willing to try develop healthcare. That's why we see the 30% grow month on month on our platform as well. As Jean mentioned, we are no near successful yet, but we have been learning a lot. And in doing healthcare, we learned that we have to be really patient because healthcare takes time. Healthcare is not just a quick grow and quick. You cannot expect quick profit or quick revenues from healthcare. You have to build the trust, you build the branding, and we focus on the quality in order to do that. And the next generation of healthcare is a lot about personalized and patient-centric. In healthcare, the human resource management is challenging for us as well, because combining both the tech and the medical is not easy, because different staff, different people have different mindset as well. Especially with the medical, it's quite traditional, while the tech is quite new and flexible and dynamic. So to manage that is a challenge for us as well. And we strongly believe that organic growth is much better than buying ads and throwing a lot of social media marketing and stuff like that. Because organic growth can help you to build up the data, to build up the personalized and build up the brand as well. When you depending a lot on social ads and media and online marketing, is not a really stable and a good way to grow. Healthcare is tough, but it can create impacts. And if you want to do it, just do it and be resilient about it. And recently we've been running a free campaign for people in the middle of Vietnam to have free video calls throughout COVID, because there is a lockdown in Da Nang and Hoi An in Vietnam, and it's been well received, and people are giving us a lot of great comments and great feedback for our doctors as well. So it's really something that inspires us to continue on this journey, and hopefully this can inspire you guys or some of you guys to start something in healthcare, because we believe that the market is still quite great in digital healthcare, and there's a lot of rooms for different players. Just need to find a good niche and focusing on the quality, and make sure that you follow the philosophy to maintain that. And that's it from us. And yep.
Thank you so much, Tuan, for really this. I thought is a fantastic use case of your company sharing with us not only the business model of the offline and online hybrid, but your values about being patient centric, and the commitment towards the personalization of healthcare. This becoming a trend. So thank you so much for sharing all these with us. I think what you shared today is very helpful for teams who are preparing their decks to submit for the innovation challenge and pitch days. So yeah, thank you so much, Tuan. And later we will have a speaker Q&A with a panel Q&A with all the speakers. So everybody will have the opportunity to type your questions in the chat, and we will have our speakers answer that. So thank you again, Tuan, for the very, very insightful case study and being so generous with us in terms of sharing what you have. Okay, so let us continue with our final speaker for today. And she is Sol Maguez from Ernst & Young. She will be sharing with us also key trends that's happening in Vietnam. So there's Sol. Hi, Sol.
Hi, everyone. Good morning. How are you?
Yes, so thank you so much. I think we'll look forward to hearing what you have to say now, having heard what Shri and Tuan provided in terms of their unique case study. So thank you so much, and please go ahead and share your screen, and we look forward to your insights.
Thank you. Yes, good morning, everybody again. It's a pleasure to be here in this webinar, and truly honored to follow Shri and the Tuan's great presentations, very inspiring. So before I start, just very briefly about myself. I'm Sol Magath. I'm a partner in the EY strategy practice Parthenon, based in Singapore. And I lead the life sciences and healthcare practice here. So from the team, what we do is we cover all sorts of strategy work for medtech, innovative diagnostics, pharma, biopharma, as well as providers. And importantly, we also collaborate very closely with our private equity teams, our digital colleagues, as well as our FinTech teams, right? Like the emerging headquarters for FinTech for EY are based in Singapore, which is very handy. So whenever we work with different types of players, either very established players or new players that are developing this type of FinTech solutions with healthcare applications, we work closely with them because we bring in the life sciences and healthcare expertise, and they bring very deep understanding of investors, of digital, as well as of FinTech, and they also bring the network and the connections. So yeah, that makes for quite a powerful proposition and very fun work. So in the next 15 minutes, I think I have 15 minutes, a little bit less than that. My focus is going to be a little bit more on the FinTech landscape itself. We'll do very high level intro on the trends. I think both Shri and Tuan have covered that really well, but then dive a little bit more on the FinTech trends and applications, as well as look at a few cases. I think I have 4 different cases. These are not Vietnam specific cases necessarily. They're across Asia Pacific, but I think they might be helpful for inspiration and some learning. So what we've done is, because there's so many, nowadays there's so many solutions and models and startups and players across healthcare tech as well as across fintech, we've tried to showcase 4 slightly different solutions, right, with different angles, so that even if we don't have a lot of time, we cover some breadth. So let's see. Yeah, without further ado, Vietnam's economy, the main message that we're going to have is that there is indeed a tremendous amount of opportunity in fintech applications in healthcare in Vietnam, right? On the left-hand side, as it's been seen, you can see that Vietnam will outgrow and outpace actually other economies in the ASEAN region. And the relatively lower COVID-19 cases, as Shri depicted very well, we think are going to be a helpful driver as well in the medium and longer term. Let's hope that the recent Da Nang outbreak doesn't get further out of control, because it's been quite unfortunate. But we definitely have very positive prospects from a pure GDP growth perspective, right, with that 7% forecast growth up to 2023. If we look at the healthcare sector and the level of spending and investment that's taken place there, we can see at a 12% growth rate, the forecast is really very, very strong to 2023. Despite those dips in some of the services as well as in some of the sales of pharma, we know it's going to remain strong, right? The government has made very significant progress towards universal healthcare coverage. I think they were already at 87% by 2018. And the target is by 2025, I think it's going to be around 95%. So that really is going to continue to drive a push. Similarly, the public-private partnerships are being really promoted by government, by policy, by regulations, and that is also going to continue to push the sector and encourage more investment going into infrastructure, as well as training and upskilling, as well as purchasing modern equipment, right? So these are very positive trends. Now, if we look at fintech in Vietnam in particular, we are quite bullish about this segment, right? We even believe that Vietnam is in a very good position to follow China's growth trajectory in that space, in the fintech space, right? Generally, not necessarily only focusing on healthcare here. So if you look at the right-hand side, in this chart, we have a few scenarios that could play out up to 2024 and give us a sense of what's the growth that we could expect. At the lower bound, the low case scenario, what we say is we could imagine that the sector grows in line with the earlier GDP growth rates. In the middle bound, we can imagine that it grows similar to the India fintech segment and follows that trajectory since 2018. And in the upper bound, we could think that it can follow China fintech trajectory, which started earlier, right, in 2009. So again, we are quite bullish, and we think that we can expect a significant amount of growth and opportunity. Importantly, if we look at the left-hand side, right, what is it that is fundamentally supporting the growth and the development of the fintech sector in Vietnam? There are some demand side conditions, and then there are some supply side conditions that all help in that development. From a demand side, we were already witnessing large and growing payments market, right? So that was something that was already there historically. It is a trend. Very importantly, there is a very sizable unbanked population. So in Vietnam, I think the adults, if you take a health adult, so over 15 years old, only about 31% of the population is traditionally banked, whilst the global average is 62%. If we then look at the rural areas, and in Vietnam, we still have 63% of the population that would be considered in rural areas, that number drops to 19%. So there's definitely going to be a push, and that's why we've seen a push for this sort of mobile FinTech type of solutions, right? Because there's a very large proportion of the population that is unbanked. Then the young population with that exponential increase in online presence, right? As Tuan said, the population is indeed aging, but remains still at this stage one of the younger populations, right, in Asia Pacific. And I think about 60% of the Vietnam population today is what we call digital native. So we're born and lived in the internet era, right? And therefore, these tend to be populations that push these trends and then also become trendsetters. And I'm sure we have a lot of you here today in the webinar. Additionally, from a supply side, Vietnam also meets some conditions that are very helpful for a FinTech development. One is that the traditional banking sector has been slow to respond, and hence those low rates of conventional banking. There's investment being poured into the FinTech ecosystem across players. And the regulatory framework environment also supports increasingly digital payments, right? I think the government there has done some very good, has taken some very positive measures. So overall, like we say, it's a very positive picture. If we look again at some of the players that are today operating in Vietnam, it is an extremely diverse and rich ecosystem. Many of the players are in the payment business. As you can see, that's the top section of the logos. This list is not exhaustive. And then we have many more players also in comparison sites, in lending, personal finance, data management, etc. So again, a very rich segment. If we look then, when it comes to FinTech solutions that are applied to healthcare, and this is not Vietnam specific, as I mentioned, this is more an APAC view, right? Again, we think that there are very positive signs that this is going to continue to be booming, although there are some challenges that may need to be addressed, but that's only natural, right? The main applications that we see when it comes to FinTech based solutions is in telehealth. So virtual consultations, just like Tuan's amazing company, as well as online prescription and refurbishment. For example, e-commerce obviously is tremendously large and growing fast in China in particular. Then funding through greater financial penetrations with health wallets, for instance, is one of the main applications. InsurTech type of products, and then access programs. These access programs can be crowdfunding types of programs. We'll see a couple of cases in a minute, or maybe more disease-specific patient access programs, more ad hoc types of programs that leverage technology for financing as well as for other parts of the value chain when it comes to healthcare. Some of the challenges that we still see in APAC, though, are for the further adoption of FinTech in healthcare, are the awareness levels when it comes to the health products that could be purchased through FinTech, right? It's still relatively low, and that's particularly true amongst the older population. And as we know, about 80% of your healthcare consumption on average will happen towards the end of life. So that is a slight deterrent. In some cases, trust is a concern, trust by consumers. But we see that this is changing progressively, and it becomes a bit of a self-fulfilling prophecy, right? More trust means more adoption and more uptake, and then it means that it's more established, it's more present and accepted more widely, and that helps to continue the trend. And then obviously you need the right digital infrastructure, and particularly fast internet connectivity, which is not the same everywhere across Asia Pacific. In terms of some of the main types of funding for healthcare that we see, right? The first category, I guess, would be mutual aid insurance, right? And here, backed by the likes of Alibaba and Tencent, as we will see in a minute, China has seen a tremendous surge in crowdsourcing insurance premiums and involving enrolling members in these types of programs. For InsurTech as well, we've seen the likes of TrueCover or ZipCover, which allow insurance consumers in India to compare policies, assess risk, and then make informed decisions for InsurTech products. We see blockchain applications as well for health insurance policies. There's an example on pregnant mothers. And then Tofi, for example, is a platform that partnered with traditional insurer Apollo Munich and launched lifestyle and not lifestyle, also healthcare applied bite-sized insurance products. We'll see the case briefly as well. Another main application for funding that we see in healthcare is localized crowdfunding. So we have the big platforms that have been very successful, such as GoFundMe and Watsi. And then now what we are seeing is increasingly the development of the local versions of those platforms, right? So yeah, we have a few examples here in India, in China, or in Indonesia. And finally, another very important application is mobile health wallets, right? So MTIVA is a digital wallet that's penetrated quite well, both in Asia as well as in Africa, right? To fund medical treatment, they can save, send, receive, pay for medical treatment through the mobile using the MTIVA solution. So these are some examples, and again, we'll dive in some of the cases in a second. When it comes to some of these potential use cases, one thing we feel is important is to try and look at the value proposition right beyond pure funding, beyond pure financing. And Tuan's example is obviously a wonderful case for that. In particular, we have four elements here, but in particular, I would like to emphasize the analytics, using advanced analytics and data to drive efficiency and value for all the players across the value chain. And then potentially also with the ability to monetize that data further. And then disease management, right? So having disease management interventions that through platforms provide value for all the stakeholders, healthcare professionals, patients, and pharma companies and other types of providers. We'll see an example of that as well. So here, conscious of time, but briefly, if we look at the crowdfunding platforms we were mentioning earlier here, right? Xianhu is, for example, one of the mutual health protection platform, right? It was launched in 2018 by Ant Financial, which is Alibaba linked. And if you can see on the right-hand side, the number of members over the last 5 quarters, it's really increased very dramatically. It really leverages the pooling effect, right? Of being able to get very small payments from very large population base and then manage risk accordingly. The maximum payouts that they provide are 300,000 yuan per claim, which is not particularly high, but it is good and also covers illnesses like lung, breast, and thyroid cancer. So it covers also specialists and pretty complex diseases. Waterdrop is another example backed by Tencent Holdings, where participants pay a very small joining fee and can also get cover for quite serious conditions, including cancer as well as a personal accident. And on the right-hand side at the bottom, you can see, not for Waterdrop, but generally, if we look at China's online health insurance premium, how it's boomed tremendously over the last 4 or 5 years. Some of the key success factors for this success in China, and we think it's very relevant for Vietnam because, again, we believe that Vietnam can follow a similar pace for success. Some of the key success factors were really around the unmet needs, right? There's very high out-of-pocket payment in China for medical treatments and medical care, around 30%. Low commercial insurance penetration rate, so traditional insurance not being able to bridge that affordability gap with a penetration of the relevant type of insurance products of around 9% only. And then also the rising middle class, right? The ability of an increasing number of citizens in China that can fund these types of solutions, right? So again, we think that these conditions are explain why this has boomed so dramatically. Some risks around the unregulated industry because they don't have capital provisions and risk management rules like other financial institutions, but this will probably change over time and in not too long. This is another example. This is the bite-sized insurtech policies that we were referring to earlier, right? It's the application in India. So it plays to the idea of buy as you go or pay as you go or pay as you use. It's essentially insurance products that one can turn on or off relatively easily. And they have applications across many aspects that can be insured, right? So home, accident, travel. But in particular, if we look at health, Toffee, backed by Apollo Munich, offers dengue insurance, for example, breast cancer insurance, and even diabetes insurance, which is not depicted here, right? So they use also their platform as well as social media platforms to reach a very large number of users and therefore bring the premiums to a very competitive prices. In the case of the breast cancer insurance, for example, incidentally, they launch campaigns such as for Mother's Day, gift your mom a breast cancer insurance cover for the next year. So it also contributes to improve awareness and so on. So yeah, let me just check the time very briefly. Yeah, I'm going to take maybe 5 more minutes. Very briefly as well, in Singapore, this is not exactly kind of a model that includes things beyond funding. It's strictly about payment gateways and enabling payment, but we feel that in Singapore, this is going to really pave the way for many other solutions to overlay, right? So Singapore, as part of the government push towards becoming a truly cashless and checkless society, has launched with the Development Bank of Singapore and their healthcare clusters a single Singapore QR system that's being rolled out progressively and over time will allow citizens to really be completely cashless when it comes to healthcare provision payment in Singapore. So it's the first unified payment in a QR code that you can use the Nets, Pay Now, PayLah, GrabPay, WeChat Pay, really you name it, they can use it, and it's being rolled out pretty aggressively since last November, since November 2019. We think this is going to provide, again, the opportunity to overlay a lot more, hopefully, services such as consultations potentially linked to these, as well as e-commerce, and down the line, the holy grail of outcomes tracking and measuring. Then we have, yes, this is important for us to convey in the sense that these telehealth platforms, right? We think of telemedicine sometimes as a single provider that is taking their consultations or their patient services just virtual. So they might have had like traditional clinics, traditional operations like a hospital, and then now, particularly also with a sense of urgency since COVID, as Shri described so well, we see the need to virtualize or digitalize a lot of those interactions, right? But on top of that, we feel that some of the players that, as Ali Health, right, which is the flagship healthcare of the Alibaba Holdings Group, those players that are going to be able to take it to the next level and really act as an orchestrator of the different players in the ecosystem. So I'm not only a clinic that goes virtual, but I'm truly a platform that provides an end-to-end solution for patients. So including online consultations, but also including e-commerce, including home delivery of drugs, including possible like other additional services, linking with distributors, linking with manufacturers, pharma, biopharma, medical devices. Those are the ones that are truly going to disrupt the healthcare space and the healthcare ecosystem, and they are ones to watch, right? So this is the example in China by Ali Health, with the overarching great aim to try to make good health available for everybody at the touch of a screen. And they have strategic partnerships with hospitals, with retail pharmacies, as well as with pharma, Bayer and GSK, are just two examples. They leverage the Alipay model as well, which means that there's 520 million users who are readily available to use their payment gateway to use the solutions that Ali Health provides. And I think I'm going to just very briefly, I don't want to go through the slide because I'm conscious of time, but there are also very interesting collaborations between pharma and different players, be it telehealth players or others. This is Novartis with Bioformis in Southeast Asia, but there's also Cipla and Wealthy in India and Abbott A-Care and many others, right, where they partner. So the pharma company obviously has the expertise in terms of life sciences, the therapy area, has the network of doctors, knows well the treatment protocols. They partner with digital solutions, digital platforms that allow, in this case, patient management and effective disease management. So they leverage advanced analytics, in this case, AI-powered analytics, to have a decision-making support in terms of predictive algorithms. They support the doctors as they monitor their patients. They support the patients as they can enter their own information, and their wearables also loads the information onto the platform. They support the healthcare providers, and they're trying to improve the way patients are managed, identify risks early, have actionable alerts that will say you need to make an intervention, either the nurse or the doctor, or patient, you need to take charge because these parameters are not looking positive enough, to improve clinical outcomes over time, right? Also generating a wealth of information. So they bring value to all the players in the ecosystem. And that will be my final slide then, which is just saying that I hope we've conveyed that we believe that there is a very good outlook for Vietnam in terms of FinTech in healthcare. Key things to bear in mind will be these solutions, those that are more successful, really tackle a real unmet need. So it's not technology focused and technology driven, right? Technology is an enabler. They also focus on providing that strong value proposition for all the key stakeholders, be it manufacturers, distributors, healthcare professionals, and of course, patients always at the heart, and are able to leverage partnerships for expertise. And then the last one, which I think, I'm sure you'll agree, is you need to fail fast and learn fast, right? So that you refine the solutions as you go in. There's continuous improvement that is necessary to really have solutions that are sustainable over time in this space. Great, thank you so much for your time and attention. Apologies because I know we're a little bit behind the time that we had planned.
Okay, thank you so much. So I thought that was a really insightful presentation. And
thank you.
The reason being, now that you have really talked about FinTech within the healthcare space, I think it's really helpful for our potential participants of pitches, that they can see now that the healthcare ecosystem isn't just reliant on medical based issues, but there are so many other seemingly augmented by integral things like the digital finance ecosystem within that, as well as we also talked about the issues of skilling people and HR, that is something that people would also need to kind of pay attention to. So what's going to happen now is we are going to segue into the Q&A, the panel Q&A, and you're most welcome, everybody. You're most welcome to actually type your questions here. I actually do have a lot of questions. So for people who want to kind of type your questions, please go ahead and we will pick that up for all our speakers here. I just want to check to make sure all our speakers are unmuted. Shri, do we hear you?
Hi, yes, I'm
okay,
unmuted.
Shri and Tuan?
Yes, I am.
Yes,
Yep.
great. And so you're there. Okay, good. So if it's okay, let me just start off by I do have a couple of questions. I think one of the key factors that a lot of us are very interested is about the digital transformation. And this has been talked and covered by all three speakers. And there was some concern about how can digital transformation or digital engagement actually become effective. So I think based on what Shri and Tuan talked about, also the element of trust, and so you did mention about the element of trust. I guess having find a way to build trust is actually going to help a lot with digital engagement of the patient journey. What are some of the other factors that, you know, we can come up with that's going to improve and make digital engagement more effective for the healthcare space? Because I think it can come, I mean, if there's a founder out there with this fantastic idea of doing something that improves the digital engagement, that's going to also impact healthcare a lot. Any speaker can answer this question. Go ahead, please.
It's up to you. I'll go first with based on my experience, right?
Okay.
So what we found so far that a lot of our doctors, they get used to the way that how the traditional because they get used to the old school process. So when you try to bring them to the system, it is really new thing, and also they don't see any values in it yet, because the values only you can see after you have a certain data and you have the long history of the patient and you see the values. So what we've been doing is that for each of the doctors, we always have one of the like assistant, one of the nurses acted as an assistant, who are more younger and more tech-enabled and more educated in the system, so that they help them to assist the data and help them to onboard them to the system. And when actually they ask more details from the doctor to input into the medical record, it's bring back to the patient that now the patient see more information and they get used to the app more. And once they get used to the app more, they input their own information as well. And actually they're using the app and the telemedicine for a following up check or for continuously seeking questions from the doctors on the app. So it's add values to the patient, and when the patient see values, there's no problems engaging them to the digital. The patient only wants to see the values, what's gonna help them, how it's gonna help them, and also, for example, the functionality that work most used in our app actually the medical reminder, because it reminds the patient when to take the medication. And before we launching the app, we didn't know that this is going to be the most used functionalities. So I think to have digitalized and to have put the process of digitalized, you have to think of how you're going to bring values to both the practitioner and also the patient. It's both ways. Yeah.
Yeah, if I can add, I think that's excellent, Tuan, and that there's that element of upskilling, right, and investing in training for the technical capabilities of healthcare professionals as well as patients to interact with all these solutions. Additionally, I think there's another aspect that is important when it comes to engagement, and it's around the customer experience. I really liked one of the slides that Tuan had on how they are really patient-centric and how they make the patient feel, you know, like, yeah, they are indeed the most important piece of whatever is happening in that interaction. In terms of improving the engagement models, I think not only you need to have training, but also you need to map out well the customer experience, right? In this case, the patient experience and the doctor experience, understand what are the pain points and how one can try to address some of those pain points through the digital solution. So again, it needs to be a very user experience focused approach, I feel, so that it will keep improving over time and we get better and better versions.
Absolutely, absolutely agree with Sol and Tuan. I think for digital engagement to be effective, like Sol and Tuan said, I think it's important to understand the customer and the patient's journey better, and actually understand, because not all patients, not all customers go through the same journey. right? The barriers for digital adoption or digital engagement could differ for different segments or different profiles of patients. So it's important to understand which patients are more receptive to certain kind of digital engagement and less to others. Understand where they are in their journey of adoption of the particular product that we are talking about, product or service, and actually customize the engagement and address those barriers along the journey for that particular or at least for the key segments or personas of patients. So that understanding of the customer, I think, and putting the patient at the center, like Tuan and Sol said, I think are key.
Thank you. Yes, thank you for answering about the gaps that we can actually improve to make the digital experience closer to the heart of our patients. So we do have a couple of questions coming in. Some of them for specific speakers, some for everybody in general. I'm just going to select a few. There's a question for Tuan. Somebody is interested to know, since we are on the topic of digital engagement and patient user and growth, somebody's interested to know if you can share some tips how a Vietnam health tech company can grow organically without buying ads. Are you able to share with us your trade secret? How do you grow?
I think it's no trick. It's just actually Sri mentioned that people now, the next generation, they prefer personalized content and marketing. They want to read or want to listen or want to see what is useful for them. So in order to build up our community, we have to provide or work really hard on our content to make sure that our content is personalized and also to target different niche, different and go deeply into each of the different illness or different disease or different topics, so that is related to the patients and actually provide useful information for our patients. We try to be community of our patients as well. So not just our doctor to answer the questions, but actually a lot of our patients share their experience, share how you can be more well-being instead of now people like actually given the COVID situation, people are actually looking a lot into prevention instead of waiting for the illness to come. So people actually pay a lot more attention to healthcare now. So grow organically require time and effort, but for long term, it's gonna stay with you forever. If you buying ads and you stop spending the money, it's gonna go away. And I think that's happened to a lot of the healthcare startup as well. So we've been learning our lesson as well, because at the beginning we try to test on the social ads as well. We see the immediate effect, but on the other hand, when we stop it, you see the intermediate effect as well. And also healthcare in Vietnam is a lot through word of mouth. So it's go back to the quality, how you're gonna make sure the customer experience, the customer journey is gonna be completed. And lucky for us, our NPS customer score has been 9.67 out of 10, and our patient actually spend around 2.24 times with us in a 3 to 4 month period. So we're focusing a lot more on the quality instead of the quantity. It may sound weird for a startup, but we believe that healthcare requires a different approach from other industries. So to answer the question is that you have to work on the content, you have to work on the quality, you have to work on the engagement of the customers to make sure that they are the best reseller for you.
Well, that's really, thank you for the very specific concrete insights of the action items that you actually take on your site. And as a follow-up to that question, there is a question actually open to all speakers here. So we talked about, the journey side of it, the patient's journey, which is the demand side of it for digital transformation. And somebody says that, how can we get doctors to be more open to adopting new technologies when it comes to meeting with medical reps and patients? Are there more practical and sustainable ways to get the doctors, which is, they are the supply side, right? Get the doctors in to actually be part of this entire digital experience for the users. Yeah.
Right. So again, that's a good question, right? That's a question that the pharma industry has been contending with for a long time on how to get doctors to adopt digital engagement and digital models of providing care to patients more willingly. I think, of course, the COVID pandemic has played a key role, and clearly in our research, pre-pandemic and post-pandemic, there's a marked difference in the behavior and responses that we get from doctors on their willingness to adopt digital models of engagement. They are a lot more willing now. In fact, they don't want to see reps in person, they're much more willing to get information through online portals or apps. So what the COVID pandemic has done has accelerated the trend. Of course, in spite of that, there will still be, not all doctors are the same, and there will still be, probably the more traditional doctors for whom it's difficult. The behavior is a lot more ingrained and it's difficult to change. But at the same time, there's the new generation of doctors who are, a lot more willing to adopt digital modes of engagement.
Yeah, I think that's, I completely agree with Sri. Doctors that we would have never suspected, or actually were actively against virtual engagement with patients, have switched around completely because they didn't have a choice, right? And across markets, from Korea, yes, to Indonesia. So that's something that the unfortunate crisis has helped with. At the same time, also doctors are obviously smart, right? And on the one hand, they can't see a lot of the reps or MSLs for obvious reasons. On the other hand, I think they're also using this as an opportunity to triage who they see and who they don't see, right? And almost the ball is back in the pharma and medtech industry court, saying if you know that you are going to add enough value, doctors might be more open to seeing you either face-to-face or virtually, right? And as Shri says, now they have a wealth of information and sources to get a lot of their insights from peer-to-peer communities, right, to obviously websites, forums, etc. So if you want to have the one-on-one engagement, even if before it was face-to-face and now it's digital, you really need to make sure that you add value. And I don't think most of pharma is still figuring out, and medtech as well, how to do that, because it's not the same to do it virtually as it is to do it face-to-face. So that will be something that then doctors will be also more open in engaging if they see that they get value from those interactions.
Okay, thank you so much, all three of you. So Sol, since you're on the topic of that, I have a question from the audience. I'm wondering, how can companies actually alter FinTech into the telemedicine model? You might interpret it as, how can we, integrate, or how will FinTech actually evolve, within the telemedicine business model? I think this is something we're all interested to know.
That's an excellent question, and I think I would go almost back a little bit to one of the cases that we brought in, right? Because if we think of telemedicine as a broader solution that only remote consultations with doctors, then FinTech can have a much broader reach. But even with a remote consultation solution only, there will be need to fund those consultations, right? There will be need potentially to fund the associated treatments, diagnostics, pharmaceuticals, etc. And FinTech can be leveraged for that. But if we then, on top of a telemedicine model, we think a little bit more broadly and we think, okay, so how are going, for example, the patients that come to our telemedicine platform, how are they going to afford some of the more high cost, high value treatments that they may need, right? So then you start to think about potential partnerships like with insurance or like InsurTech, right? Or crowdfunding and adding solutions that allow your patients, your telemedicine platform, to access more and more of those services and goods. I don't know if that answers the question, but
I hope so, but I do have a follow-up question to this. This comes from me personally. So today, I think you've talked about, how FinTech and all the other technologies provides accessibility in terms of healthcare. I'm curious because Sri, you showed a very interesting slide of, demand for medicine and things like that. What about prices? Because this is something we have not spoken today. How has price, the change and fluctuations of demand affected prices, even though we have accessibility, even though we can reach the unbanked population? Is it going to be cheaper with telemedicine and all these? I'm opening up this question to everybody.
Well, that's a very tricky question, right? And there's no simple answer, I think. It will depend on the segments of treatments that you are probably thinking of, right? If you are thinking of some of the more fundamental basic treatments that come as governments roll out universal healthcare coverage, right? We're talking about some of the essential medicines and vaccines, antibiotics, etc. I think yes, we can be confident that some of these e-commerce platforms, through procurement, through price transparency for the consumer, will bring prices to be more competitive. If we are thinking about the high cost, high value products, such as very sophisticated oncology treatments or immunology treatments, and now with cell and gene therapy and so on, I'm afraid, obviously costs of goods and R&D, etc., are very high, and companies can't afford to reduce too much those prices. But hopefully, there'll be the cost of acquisition for the patient will be lower through some other FinTech solutions, right? Be it crowdsourcing, be it a GoFundMe type of model, or things like that. But we'll see. The jury is out, I guess.
Okay, that's a good way of looking at it, because for our innovation challenge, there are two themes which focuses on two themes that focus on accessibility as well as the affordability of healthcare in general. So that was really good insight. I have a general question from the floor. It's addressed to everybody here. How can the healthcare industry address the issue of data security and the potential misuse of data within the ecosystem, now that everybody's talking about collecting those data and having it all digitized? So has that something come up in terms of security and privacy protection?
Of course, that's a key issue here, because whenever it comes to digital engagement, there is this question of individual data, and how is that data being protected from potential misuse. I think more than an industry question, it's probably more of a regulatory question, and we are seeing the regulatory environment evolve to address the changes that are happening in the industry. So there is of course, a few countries in APAC are much ahead when it comes to regulations around data privacy. But most countries do have some kind of a framework. And from an industry point of view, of course, it goes without saying, the industry has to comply by the strictest regulations that apply to individual data.
Okay.
And I think, she's spot on, right? And once we saw even Sync Health being hacked, right? And over
Yes.
1 million patient records. So we know even the government with the strongest systems are exposed. So I guess from an industry perspective, it also means that inevitably, to a certain extent, we might end up a little bit like in banking, having cybersecurity teams that are very busy in most of the big players. As Shri says, it's a lot about the regulation, the right frameworks, technology, blockchain, and other solutions can help. But ultimately, I think a lot of our resources are going to have to go in protecting the data. Yeah.
Right. Okay. So, and I do have another question from the floor. Are there technologies out there to overcome the needs for physical examination? You know, like taking blood pressure, blood assay, or other kind of touch points versus a traditional doctor visit. Are there technologies that can do that right now?
Yes, I can answer to this one because recently in Singapore, there's a company called Nation, if you heard about it. And because they were doing the bracelets for the events, and because of the COVID, all the events are closed. So they changed to temperature recording and geolocation bracelet armband for people, so that they can monitor the temperature, and also the health. And I think there's a lot of potential for IoT device. Actually, there's another startup in Israel called Tito, and we're working with them. They provide the family with the different medical device so that the doctor can teach you how to, for example, look into the tongue, or look into scan the tongue, or scan the throat of your children, so that the doctor can read the result for you. So there's a plenty of companies are working on those technologies to help provide the doctors with the home testing. Yeah.
Yeah, that's really good insight, Tuan. So basically, the point that you mentioned about how IoT will actually come into play, move really, really quickly, you know, within the healthcare space. I think it's another huge trend to watch. That is something that you know will be definitely more impacted even with 5G, because in Vietnam right now it's 4G that's being used, but moving towards 5G, and that will also bring a new dimension of impact. And I was just wondering, with you know all these you know, whether it's self-medication that you have mentioned, you know, everybody has talked about that. You know, whether it's telehealth, what's the risk for misdiagnosis? You know, how can we narrow that gap? You know, between they're not seeing their doctors, they're just relying on algorithms or machines to probably tell them what is wrong, and how do we reduce that risk for misdiagnosis if people do a lot of self-medication or self-assessment?
I think there's a couple of ways you can make sure that the good result for that is that we are setting up a few pop-up clinics where we have our nurses instead of our doctors. So when nurses do those touch point, you know, blood test, physical examination, they still have the medical expertise, but we don't need to require a lot of doctor resource at the place. But the doctor can read the results or doing telemedicine from our central clinic, from our central hospital. Secondly, what happened is that you can do telemedicine with multiple doctors at a time. So, for example, the other doctor may review the results and review the scanning from review the treatment from other doctors. And if there is any result or anything that is maybe missing or maybe is not logical, they can review and help each other as well. So I think there's a lot of different ways for you to make sure that you have the good treatment for the patient.
Okay, thank you so much for sharing. And I'm also curious to know, you know, given that there are so many elements that make up the healthcare ecosystem, if you know, an entrepreneur were to come up with an idea that kind of, you know, solves certain gaps, in your opinion, what do you think are the most urgent solutions that the healthcare sector might need, whether it's kind of integrating insurance with mobile apps, preventing fraudulent claims, whether it's, you know, about branding or anything else? I'm curious, what do you think? What are the most urgent solutions that we need today? Whether it's in Vietnam or ASEAN.
Yeah, I think, I mean, we've been discussing that quite a bit, right? The telemedicine and telehealth segment. I think What we are seeing essentially is patients are now not as willing to visit hospitals and clinics, which is why telehealth is playing a role. But there are limitations, like we've been discussing, right? Diagnosing new patients and bringing them onto treatment with telehealth or telemedicine still remains a challenge, right? I think the adoption that we see currently of telemedicine is more for patients that are already diagnosed and more like repeat visits or renewing prescriptions. But telediagnosis still remains a challenge. Like Tuan said, there are many startups in the medtech space that are looking at this. And over the short to medium term, over the next couple of years, we do expect this field to evolve. There are large unmet needs here, and as the technology supporting this improves, we'll see a lot more adoption, obviously, of telemedicine.
Yeah, I think one thing that to overlay there is also the use of data in advanced analytics, right? As all these technologies evolve, obviously they'll be sharing more and more data in the IoT as well. But also, if you think about maybe a patient needs a face-to-face consultation for some of these initial diagnostic, then might go away, and we essentially will be only followed up remotely, right? If we have good data collection, right, and then we can do much better risk management. If there's a strong database that the system will pick up, if there's a contraindication, for example, in the pot that or the pack that patient bought in the retail pharmacy is contraindicated with one of the prescription drugs that the doctor had prescribed, right? So in terms of doing risk management, not only for adverse events and contraindications, but also beyond that, disease management, that can be very powerful and provide better outcomes despite all these risks that we are seeing as well, right? Or to counterbalance those risks, probably rather.
Yeah, and on topic of big data, I think it's a great follow-up to a question that came in regarding big data. Where are the opportunities and threats to the healthcare industry, and if there are specific low-hanging fruits? So perhaps you've already answered a part of this. This person would be interested to know, are there other opportunities with the data that's being collected, or are there significant threats?
Yeah, in terms of, well, there's some threats to established players, I would say, some of them at least, right? But there's a lot of opportunity, right? So if we think opportunity to improve people's health, tremendous. If we think also opportunity for new businesses and new startups as well. Actually, if you want, we published a paper earlier this year about valuation of medical data. That we can share. It uses the national health system of the United Kingdom, but to look at, once you have very rich medical data, very rich patient level data, right? What are some of the uses that you can do, right? And obviously all the way from screening to find new R&D targets for pharma or medtech or genomics to develop products, all the way to disease management, reduce costs for providers, for insurers. If you think at any player in the value chain, the right use of medical data will either bring costs down for them or improve efficiencies in a different manner, or allow them to bring more value to their core businesses. So there's a lot of opportunity.
Yeah, absolutely. So I think having that rich patient level data does bring down costs a lot. Clinical trials, for example, and identifying or establishing the efficacy of drugs in a real world setting. A lot of these studies currently have to be conducted prospectively, cost a lot to actually bring in volunteers and track the data. But if this can be achieved through retrospective analysis of patient level data, there is a lot of savings which can then be passed on to governments and payers, right? And bring down the cost of healthcare in general.
That's good to know. Now I have one last question before we wrap up the panel. Now, you know, with all these changes coming, okay, and I think Tuan also addressed that, you know, the need for having a workforce ready mindset, and to really have HR and reskilling ready. What are the most you know, needed skills for today's healthcare workforce in driving all these innovation and technology that's going on? In your
I think
anybody yeah.
I think
What do
for
you
me it's
want most?
actually for all of the recruitment that we do, the most important thing for us is growth mindset, because when you want to grow, then you will be willing to learn. And with the healthcare and digital healthcare, there's new things every day, even on the healthcare itself as well. The treatment, you see it updated every day as well. So even if you are really an expert, you are a really good doctor or nurses, you still need to keep updating your knowledge, keep getting the new treatment or new information every day. So I think to be in healthcare and with digital, you need to be growing every day as well, together with the company, together with the platform. And I think that is the most important thing, skill that we look for in our resource. Yeah.
And for Sri, I mean, because you were talking about how even pharmaceutical companies have to change their business strategy. Now, how has that impacted so-called the skill set that's needed by, you know, the modern healthcare executive to deal with all these?
Yeah, you're right. A lot of uncertainty, first of all, around what's the best model to adopt at this time. Skills or capabilities around being being receptive to newer methodologies for evaluating the effectiveness of of different engagement models. So analytics is a key capability, advanced analytics, and the ability to leverage artificial intelligence, machine learning kind of algorithms to be able to assess effectiveness of engagement, and then kind of decide the right way to engage. At a sales rep or a sales and marketing perspective, again, the ability to effectively adopt digital modes and digital methods of engaging with doctors, as opposed to the traditional face-to-face personal engagement. I think these are skills that would become increasingly more relevant. And the industry has to start looking at upskilling or reskilling its sales and marketing or customer facing or patient facing teams.
Thank you so much. Okay, we are actually about to the end of our panel. Do any of the speakers here, do you have any closing remark you want to make? Please feel free to add a closing remark.
For me, I would just want to thank again you and all the participants for the great discussion, and Sri and Tuan as well for the great co-panelists.
Yeah, okay. Thank you. Yeah, go ahead, Tuan.
Now, just I want to say thanks as well. I think it's a really good effort from you guys to organize this, given the situation that we are in at the moment. And I think we will look forward to more webinar with you guys as well.
Yeah, I echo the sentiments. Thanks to Healthcare FinTech Alliance for hosting this webinar. I really enjoyed it. It was fun participating, and an absolute honor to share the panel with Sol and Tuan.
Okay, thank you, Sol, Tuan, and Sri, for really, giving us and sharing your time with us with all the great insights. I think we had a very comprehensive discussion, as well as from your presentation. We really kind of completed, at least covered a lot of the ecosystem. So I just want to reiterate that today's webinar is really a learning session for our Vietnamese communities, especially for entrepreneurs, professionals, and high ed students who want to participate in our innovation challenge. And please do keep in mind that the deadline to submit your application would be the 30th of August. And with that, we will have a qualifying round, and successful applicants will actually benefit from a month long of training in September to prepare you to compete in the regional rounds. So I guess the next important key deadline to remember definitely is September 30th. And what we like to do now, if everyone is okay, would you please enable your video, because we really like to take a picture, a screenshot of all of you here to be able to kind of share with us. Is this something that everybody can do, just to enable your video for now, so that we can do a thumbs up and do a nice screenshot? Yeah, I do see some faces. So we have a very good community today. I really thank you all, because a lot of professors here. I know that actually a lot of people stayed throughout this webinar, which is great. And we also have professionals and advisors, so that is good. So let's get some more people to just enable your video. We just want to like see your nice faces, and thank you so much for being part of this experience. I think it's great leading up to our actual innovation challenge. Yes, we want to show the Indonesian team that we got great people from Vietnam coming in. And I think my colleague from FinTech Academy would help with the video capture. So shall we just maybe do a quick like thumbs up, so that we can see that? Yes, I think all of you here are very good friends of Dr. Ko, and she's very happy. I'd like to convey thanks on behalf of her to everybody, saying thank you so much for joining at today's webinar. Okay, so we'll just hold here for maybe about 10 seconds or so while my colleague gets this done. Yes, and please smile. That's so cool. Okay, thank you all again. Thank you all so much over here. And I'd like to thank also the organizers of today's webinar, Pfizer, Alibaba Cloud FinTech Academy, and all the supporting universities, including ICAEW, our speakers coming from IQVIA, coming from Net 24/7, as well as from Ernst & Young. So thank you all so much. And please join our Healthcare Alliance LinkedIn group. This is only the Vietnamese community. We are actually very well linked to all the other ASEAN communities. So keep a lookout for the next regional event. Okay. And you can join our WhatsApp group. You can scan this QR code to join our WhatsApp group if you like. Yep. And congratulations for a very successful webinar. I felt that we learned a lot today. So if Dr. Ko, you want to say something?
Good weekend. Thank you.
Thank you, everybody. Thank you so much.
Excellent.
It was excellent. Thank you, Sol, Sri, and Tuan, and thank you, everybody, for coming.
Thank you. Bye.
Goodbye. See you in our WhatsApp group and our LinkedIn group.
Bye. Thank you again. Bye.
Okay, great. So Weisia, so it's four of us here. Dr. Ko, are you okay? I think today was a good, very, very good webinar.
Perfect. Thank you so much.
Yeah, the content was really, really good. I think the audience was also, it's okay. I think 34 something is pretty, they actually stayed throughout, which I think is a very good sign. So Yeah, that was really good. So yeah, I'm happy. I'm actually very happy with it.
Wonderful, wonderful. And you
Thank
got
you, Wei Xiang.
first, but yeah, turned out very well. Yeah.
Yeah, it turned out very well.
Mm.
Yeah. Okay, great. So we will.
Okay. Have a restful weekend. And then we probably will get together again with our Vietnamese universities because we have to push.
Yes.
Yeah.
Yeah. So yeah, Wei Xiang, a huge thank you for.
Wei Xiang couldn't sleep last night.
I know. I really like thank you so much.
Yeah.
Yeah,
Thank you so
yeah.
much.
Yes, yes. So I think the next push, Dr. Ko, I think we should start finalizing the judges for the Vietnam
That's for
qualifying
sure.
round. So
Yes.
we don't wait till actually even the speakers today, they might be kind of good options as well as others from Pfizer and Alibaba.
Yes, we definitely need one from Pfizer. We definitely want the country manager from Pfizer,
Okay.
Alibaba, and we want real VCs with money to invest in them to be the judge.
Okay, okay. So I think this is, I will put this definitely a priority on my list. I think getting the judges in is really important because we are just like 2 weeks and they have to kind of screen.
Yep.
Yeah, and then there'll be a lot of planning. But
Yeah.
I think it's a good, this webinar is going to let the professors know like how solid the innovation challenges, and they will definitely push for more people to join.
I hope so. They seem to be quite impressed. So, okay, that's good.
Yeah. So, okay, thank you so much, and we'll catch up again. Thank you so much.
Thank you so much. Have a good.
Okay, I'm going to end the meeting.
Yep.